We welcome back John Kastanis, President and CEO of University Hospital in beautiful Newark, New Jersey. Good to see you, John.
Likewise, nice to be here.
I should disclose University has been a long-time underwriter of our programming, particularly on the healthcare side of the Caucus Educational Corporation. John, biggest challenge in urban healthcare today is fill in the blank.
Maintaining high quality care and trying to do it all within an increasing reduction in resources, financial reimbursement from third-party payers.
What does it mean, third-party payers?
Well, Medicare and Medicaid, which is the government category, any state appropriations, local appropriations. As we all know, most municipalities, even starting in Washington, everybody's challenged with their budgets.
That's right.
And with that, it trickles down. And when you have a public acute care hospital, such as University Hospital in Newark, that's owned and operated by the state of New Jersey, along with the state's budgetary challenges, it trickles down to the hospital as well.
So it's so interesting. University, it's not run by the state. You lead it. You don't work for this. You're not an employee of the state of New Jersey.
I happen to be, as are most of our employees. However, to your point,
but you have your independence.
We have a board of directors
right.
that are really the ultimate responsibility for running the hospital.
It's so interesting. You've been, by way of background, we were just saying before you got in here, a few years in the industry?
Try 38.
Started in hospital administration immediately?
Yes. Frontline administrative position right out of graduate school. Way back in 1980 at the Manhattan Eye, Ear, and Throat Hospital. Moved on to work for New Rochelle, what used to be called New Rochelle Medical Center.
Right.
Then on to working with the Sisters of Charity on Staten Island. And then the Hospital for Joint Diseases in Manhattan, which ultimately merged with what is now called NYU Langone Medical Center.
Sure. Bring it back to North. The constituency, the population you serve, describe it.
It's what we refer to as a vulnerable population.
Vulnerable.
But when you talk about racial or ethnicity, half of the city, more than half of the city is African American, with many other minorities. I remember a stat off the top of my head where about 47% of the families that live in Newark and use our hospital speak a foreign language in the home.
Right. What about the whole insurance? Underinsured, insured, what's the situation?
We have a large portion of the population that are eligible for Medicaid. And with the Affordable Care Act in play, we became an expansion Medicaid state here in New Jersey. That benefited places like University Hospital because it expanded the eligibility for those that were a little bit above the poverty level, where the poverty level was at 100%, it's now at 133%.
Did it help, John?
It helped a lot.
The ACA helped?
The hospital did get to see more Medicaid-insured patients coming to the hospital rather than all those that were presenting without insurance at all.
So interesting. And this is not a political show. It's a public policy show. So I don't understand this. The repeal of the individual mandate, okay, of the ACA. How does it impact the population you serve?
That's specific to the insurance exchange plans.
Okay.
It doesn't pertain to those that are now eligible for Medicaid. To be honest with you, we didn't see anything significant in terms of patients that are opted to buy the discounted insurance exchange plans with subsidizations, which is a whole other controversial issue right now. But we didn't see people who signed up with these insurance exchange plans. There wasn't a significant sign up in Newark, and as a result, we didn't see anything significant. But the Medicaid expansion piece was important to the hospital.
The whole question of transparency, there's a lot of discussion around, you get a hospital bill, wow, look at that bill, where'd that come from? And there's an effort in the State House as we speak right now to change that whole dynamic so that there's more transparency. Explain that.
I think what you're referring to, Steve, is the out-of-network issue.
Does that affect University?
To an extent, not too much. Again, we see a lot of government reimbursement, Medicare, Medicaid, and government subsidization. But on occasion, because we are the only level 1 trauma center, for
let's talk about that.
You have patients that are brought in from outside Newark, outside of Essex County, to our Our
Explain
specialty.
what that means, the Level 1 Trauma Center.
We're the only level 1 trauma designated center in northern New Jersey, meaning the highest level of injury, the level of specialty care that's needed to help somebody survive and get better is really centered at Newark Hospital. And we have medevac helicopters bringing patients from all over the area, particularly from the northern part of the state, and that runs at a very high cost. But with that, you might get patients that are not under Medicare or Medicaid, but their insurance plan is not negotiated with the hospital. And they'll get a full bill from the hospital if their respective insurance company refuses to pay the bill. So the state has grappled with this, I understand, for the past 8 years.
Yes.
And there might be some recent legislation that we think the governor is going to sign off on.
Governor Murphy.
Correct. Where there's going to be an arbitration process where the parties will get together and there'll be at least some adequate reimbursement to the hospital that's not part of the insurance network that the patient has covered.
Sorry for interrupting, John. The time we have left, I'm curious, fiscal challenges in the state, you being connected to the state. Do you think most folks understand the challenges that University Hospital faces every day and the importance of those dollars?
In all fairness, probably not. We have a dependence on charity care funding, which the state...
Is that people who come in?
Correct, people with no insurance at all. And we do get a special appropriations funding every year, but again, that's dependent on the availability of funds that the state has. So in those areas, we watch very carefully on how the state budget is evolving. And of course, we do our best to input to the state and our elected officials to understand the importance of that special funding to University Hospital. Because not just for the denizens of Newark, but for all of Essex County and the surrounding areas, we have a lot of great surgical specialists, including our liver transplant program, our fairly new vascular wound center. We have a lot of specialists that are needed, not, again, just for the local Newark residents, but also for those that really need specialty care, in addition to the trauma services we provide.
John, listen, complex stuff I know, and I know the population you serve every day that is vulnerable. You used that word early in the conversation. We thank you for joining us and enlightening us. We appreciate it.
My pleasure. Thank you.
All the best.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. State of Affairs with Steve Adubato is brought to you from the Agnes Veris NJTV studio at 2 Gateway. Funding has been provided by Valley National Bank, Georgian Court University, PSC&G, Johnson & Johnson, NJM Insurance Group, United Airlines, and by the Port Authority of New York and New Jersey. Promotional support provided by NJ Biz, All Business, All New Jersey. And by New Jersey Monthly, the magazine of the Garden State, available at newsstands.